Hello, everyone, and welcome to today's webinar, Establishing an Integrative Health and Wellbeing Program, Reflections on a 3-Year Journey. My name is Tamara Moore with the Reese Group, a communications firm in DC. I will serve as today's moderator. Before we get started, I'd like to go over a few items so you know how to participate in today's event. We've taken a screenshot of an example of the attendee interface. You should see something like this that looks on your computer screen in the upper right corner. If you've joined today's webinar by telephone, please enter your PIN number, which can be found in the audio pane of your attendee control panel. All attendees will be placed in listen-only mode. You will have the opportunity to ask questions during today's discussion. To ask a question, submit your question through the Q&A section of your attendee control panel. We will collect all questions and address them during the Q&A session at the end of today's presentation. If you have an issue with the webinar technology, you may type your question through the Q&A section of your attendee control panel, and someone will respond to you as soon as possible. You may also contact GoToWebinar technical support by dialing 888-259-8414. Today's presentation is being recorded and will be posted to the Leadership Program website in the coming days. I'd now like to turn the call over to today's host, Damien Galena, Manager of the Leadership Program in Integrative Healthcare at Duke University. Damien?
Thanks, Tamara, and thank you all for joining us today. We have a great program for you today, but before we get started, I just wanted to mention that the Leadership Program in Integrative Healthcare is now accepting applications for our 4th cohort to begin in February of 2018. If you're interested in applying, you can get more information about the program and access the brief application at integrativehealthleaders.org or contact me at damien.galena@duke.edu. Through extensive personalized leadership training, guided curriculum by integrative healthcare experts, and mentorship from faculty from the Duke Fuqua School of Business on project planning, our program can and is changing healthcare leaders' lives and the outcomes they achieve in line with the principles of integrative health. With this in mind, I am thrilled to be joined today by 2 alumni of the Leadership Program who have done truly amazing things to further integrative healthcare. Alka Gupta and Chiti Parikh are guiding the advancement of integrative healthcare as co-directors of the Integrative Health and Wellness Program at New York Presbyterian in collaboration with Weill Cornell Medicine. In their practice, they stress a whole-person approach to care that partners with the patients to empower and further their commitment to improving health. Today, Alka and Chiti will share how this rapidly expanding program was built and how the training they received in the Leadership Program in Integrative Healthcare contributed to its success and their vision for the future. With that, I'd like to turn the call over to Alka and Chiti.
Hi, everyone. This is Alka Gupta, and sitting next to me is Chiti Parikh. And together we launched and now lead the Integrative Health and Wellbeing Initiative at NYP and Cornell. So thank you all for tuning in. We're very excited to be here. And we wanted to spend this time today really sharing our path to developing this program. We're in a kind of a unique situation, and we've learned a lot. So if anything that we've learned can help to benefit you in bringing this to your patients, we're here to help. So for some background, I want to start at the beginning of our story, which does take us back a couple of years when the 2 of us met. Both of us had kind of different initial interests in integrative health, but we had similar background and training. So we were both trained in internal medicine as well as integrative medicine, and we were both working at the time in division of hospital medicine. And at that time, we determined that we had some shared interest, and we realized that nobody at NYP or at Cornell was offering integrative type healthcare to our patients. So we started by doing some research on some programs across the country that have been very successful in the past, and we started to conceptualize what a program that would fit our institution might look like. Eventually, that led to putting together a business plan, and as we began to approach leadership at Cornell, we realized that there was actually a lot of support from leadership. So we pretty quickly went from engaging people like the division chief of hospital medicine to the chair of medicine, and eventually up to leadership as high as the CEO of the hospital system. Now, we were able to accelerate this program's growth in part because at the same time there was construction ongoing on an ambulatory care center that's now set to open early next year, so early 2018. And due to pretty heavy leadership support, we've been able to secure dedicated space dedicated to integrative health and well-being, and we're planning to move in 2018. So about 2 years ago, we started on this very exciting path, but we then needed to start to put together a plan. So at that point, things started to get a little bit more interesting. So we started out by setting out a strategic plan, conceptualizing what program content, program structure would look like, understanding how the program's infrastructure could be set up, and understanding where the program could fit within the organization. And as we went along, we found that hospitals' priorities were actually quite aligned with the things that integrative health can offer our patients. So while taking into account hospital priorities and ours, we decided to pursue launching this program with an initial focus on oncology and pain management and attempting to improve the type of care delivered in those two departments. Next, it was important to start to define what success looks like in 2018. So remember, this is 2 years ago, so our parameters for success were quite broad, but we did realize that we needed to begin a clinical program, and earlier would be better than later. And a second major thing that we learned from talking to leaders of other successful programs across the country was that it was very important that we integrate within the hospital. So it was not only important to integrate within the new building that we were moving into, but it was also important to integrate within the medical center, and then also to create access to our regional community, so the Manhattan community, and allowing increasing access to these types of services for as many patients as possible. So from there, we started to plot out a timeline, and we decided to do a soft opening in 2016. So we actually began the clinical program on a small scale about 1.5 years ago now, which allowed us 2 years before launching at a much larger scale to learn and to grow, so to better understand what resources already existed within the hospital, to meet clinical leaders and understand what their priorities were and how we could help their patients, and also to understand which types of services were being utilized and requested more often. So from there, it was important to find a space to deliver these clinical services. We were able to locate a smallish space that was already in use by a Cornell practice, which alleviated some of the steps that might have otherwise had to take place. So this did allow us to share staffing, share scheduling staff, registration staff, billing and coding staff, making us able to launch this more quickly than we otherwise would have. And in this space, we've now begun offering, in addition to physician consultations, also nutritional services, mind-body instruction, acupuncture, massage therapy, and we've been growing slowly since. Now, in the last 2 years, we've spent a considerable amount of time focusing on these areas, especially the first 4 listed on the slide. So we're going to spend today, for the most part, talking about these 4 focus areas, what we've learned, things that we would do differently a second time around. And let's start with organization and operations. So when we started, I don't think either of us really thought that this was going to be as interesting a journey as it was, but we actually took almost a year to finalize our organizational structure and almost a year to really solidify where within the hospital this program would fit. So to give you some background, New York Presbyterian is a hospital system, and there are 2 major academic medical centers of Cornell and Columbia. Columbia within the hospital system, as well as 4 somewhat smaller, more community-sized hospitals. So when laying out the vision for this program, the initial strategy is to launch this as a collaboration between Cornell and NYP, but the ultimate vision many years down the road is for this to permeate the institution's culture and be present at all locations and in all patient settings. So we needed to create a business structure that would allow that to happen in the future. So we began to delineate the structure, funding, space. We started to set in stone how we would be recruiting, how we'd be hiring both clinical staff and support staff. We created a structure for clinical and administrative oversight. It also involved choosing one electronic medical record, as well as billing and compliance concerns. And from there, once we defined those roles and those responsibilities, we created a program table of organization to better delineate that oversight, delineate reporting structures, and then also delineate feedback mechanisms. And creating this organization, this structure, was really instrumental in helping us to anchor the program within both institutions at a very high level. So it did ensure that we had the right people around the table throughout the process as we were making decisions. So the next step was really to create content and set ourselves up for the move in 2018. So we started to look at what things were in our favor and what things maybe were working against us so we could get ahead of the curve. One of the most major strengths that I've already alluded to was the unwavering support of our leadership. If I had to focus on one major strength, I think this is the one that's allowed us to accelerate our progress the most. And then also the fact that the hospital has a large and diverse patient population. We already offer multi-specialty care. So there was already a set referral network that allowed us for patients to flow into the program as well as allow patients to flow out of the program. Another exciting opportunity that is a bit unique to our situation is the fact that we do have 2 major academic medical centers within one umbrella. So that allows for some really exciting collaboration down the road. We also found, as we did some more research in our hospital, that many patients that we were already seeing were going elsewhere for these services and not always to the most reputable sources. So we were able to offer these services with a very high quality and a very high standard of care within our walls, which I think patients have really enjoyed. And then, actually, unfortunately, another major IH center in New York City did close around the time that we began to offer these. So while overall, it was a loss to the field of integrative health, I think we were able to help out a lot of patients who were looking to transition their care but didn't necessarily have somewhere else to go to in New York. Major weaknesses, anytime you have a large number of people that are as engaged and as excited about a program like this, there's always a potential to have some differing interests and motivations. So that was one of the weaknesses at the beginning. And then the second would be the fact that we had to grow very quickly. So because we were poised for such a high-profile launch in 2018, we really needed to do our homework ahead of time and set ourselves up. And it did mean that we had to make some riskier decisions as far as hiring and recruitment and ramping up the clinical program. So in an effort to maximize our strengths and minimize our weakness, we started to look at our new home. So we started to look at where we were going to reside 2 years from that time. And then we positioned the beginning of the program around those opportunities. So we centered a lot of our content, a lot of our outreach around oncology, around GI, and around pain management, because we knew that those patients were looking for it and they were going to be geographically close to us. And then we just went to the right people. So in addition to engaging leadership, it was important to get a little bit closer to the patient to figure out what the patient really needed. So we had regular interaction with the chiefs of ambulatory medicine and hospital medicine, started meeting with the chief of division of oncology, Department of Radiation Oncology, pain management. I think what we noticed the most during this process is that to really figure out what the patients need, you need to move to as close to the patient as you can. So often those were nursing directors or social work and care coordination teams that were the most powerful advocates for this type of healthcare. So I think that would be a strong piece of advice, to really move as close to the patient as you can when you're trying to figure out what your patient population needs. And from there, it was a matter of getting the word out. So at the beginning, our marketing and education efforts were actually quite brief and quite basic. And we figured out the most important marketing was really talking and teaching. We realized that integrative health is a somewhat misunderstood field, and there are a lot of confusing terms out there that are confusing both to patients but also to providers. So the most important thing we could do was educate fellow physicians, nurses, really all levels of healthcare providers about what integrative health is. So we spoke at grand rounds, divisional presentations, put together online emailed clinical bulletins, and we used education as our main marketing push. Really, the only external marketing that we did was through existing programs like corporate health, where we did do some seminars at some major financial and law firms in New York City to get the word out to the community. And then we also created a short video, so about a 3-minute educational video, so that a patient who was visiting our website would be able to hear in our own words what type of care integrative health offers. If you're curious, you can check out our website. It's on nyp.org/integrative health, and you should be able to see the video. So over the last 1 year, since we started seeing patients, we've gained a lot of feedback about our progress and been able to monitor our performance along the way to help inform next steps. So to go over the performance monitoring strategies, I'm going to hand it over to Chiti.
Great, thank you. So the reason why I wanted to spend a bit of time talking about the key performance indicators is often, it's important to do a health check or a pulse check on a relatively new program to understand which direction we're heading in. Now, Alka mentioned, this is sort of a trailblazing initiative within such a massive institution. A lot of things we're doing have never been done before. So to understand whether we're in the right path or not, the more check-ins we do, the sooner we can correct our mistakes and get us back on the right track. We have this very short timeline of 2 years, so we have to do a lot of learning, a lot of growing up within that time. So it's even more important for us to do these pulse checks on a regular basis. So we spend a lot of time in understanding, what are these indicators? How do we measure objectively how well is the program doing? So in order to come up with these metrics, we want to make sure that these metrics that we select are specific, actually measurable, attainable, realistic, and very time-based. So the next exercise that we did was really understand what are the differences between conventional medicine programs or practices and integrative medicine. It's very important to understand and highlight these key differences between these practices, because that will dictate how we measure success. So conventional medicine model, most of the practices are insurance-based. There's established processes. There's race-specific demographics. So, for instance, if you're opening a cardiology practice, you know what type of insurance you will enroll your providers in. You know where the patients will be coming from. Mostly refer from a primary care doctor or the hospital. The demographics, the age, or the payer mix might be predetermined. And also, there's a lot of reliance on human capital, because you want to invest human capital in anywhere from checking the patient in to making sure they're billed properly, and so on and so forth. And the focus is always going to be on disease management. And how do you know which patients are coming to you? That's based on their diagnosis. So it's very sort of reactive medicine, and we're really labeling the patients based on a disease and then providing care. And overall, on a national landscape, we realize that this conventional medicine model, we're seeing a lot of decrease in reimbursement, and that's something that majority of the healthcare systems are grappling with. In integrative medicine, on the other hand, most of the practices tend to be more of a hybrid model because things like physician consultations and a lot of times acupuncture and nutrition could be covered by insurance, but not all insurance. And things like yoga meditation or massage, those things are not reimbursed by insurance. So there's often a hybrid model. And this is sort of uncharted territory. So just to give you an example, when we started accepting insurance for acupuncture services, really no other program had really done that. So we were going into these uncharted territories without much information as to how do we need to write the notes, how do we need to code and build these services to get the maximum reimbursement. And also our demographic is very diverse. So the patients who tend to use integrative medicine can vary anywhere from 18-year-old to 80, 90-year-old patients, and across all types of symptoms and disease spectrum. And one of the strengths of integrative medicine is it is amenable to technology. That some of these services can be provided through telemedicine, and because we have such a diverse demographic, we can use technology to correct some and expedite some of these processes that can be slow in a conventional medicine model. And our focus is on prevention, so it's not just if someone is coming in for one consultation, there is continuity of care. So we want these patients to keep coming back so we can help them stay on track. And when you look at on a national level, there is more and more insurance coverage for some of the services that I mentioned. So just in February of this year, American College of Physicians came out with their guidelines for management of back pain, low back pain. Low back pain is one of the most common reasons why someone would go see a primary care doctor, and it plagues millions and millions of people in the country. So what ACP did was revise their guidelines to include things like acupuncture, yoga, meditation, massage as first-line treatment for low back pain. The patients are supposed to get these modalities before they even take any medication. So that really changed the language and the tone of providing acupuncture coverage. So just within the last 6 months, we've noticed a significant number of patients now have acupuncture coverage for pain management. And this is just the beginning. As more and more research studies come out, we'll see insurance company providing coverage as they see even benefits in more preventive approach rather than more reactive approach. And to a certain degree, we have to reinvent the wheel, but we also wanted to be mindful of what actually existed in the current healthcare system when it comes to measuring performances. So one of the first things that Alka spent time talking about is identifying and engaging our stakeholders as we're making these benchmarks. So when we're trying to assess how are we going to define success, it's important that all the stakeholders are at the table because, as Alka mentioned, everyone has a different picture of what success looks like. So it's very important to bring everyone to the table, to define a clear vision, make sure there's alignment and collaboration among all stakeholders so we can create a transformative change and appreciate all the effort that has to go into it. The next step was to really identify, what are the overarching keys to success. And we knew that our vision was always to provide affordable integrative medicine services, improve access to these services, and ultimately create a financially sustainable program. We can only help our patients if we stick around and we are financially stable to provide these services on an ongoing basis for many, many years to come. So we always wanted to keep these three important sort of objectives in mind anytime we were defining a performance indicator. So the existing metrics, when we talk to a typical hospital-based clinician practice, you define success purely based on, financial metrics, such as how much revenue came in, how many expenses. We wanted to take a step back and really think outside the box and bring in some of the special things that integrative medicine can do for a hospital system that some of the other practices might not. So we wanted to include things like patient satisfaction, employee engagement, number of new referrals, the PR value of a program like this, and how innovation and technology can help drive volume to these services. We wanted to figure out how to include these metrics that integrative medicine can do really well and put a number to it and count that into a regular sort of P&L statement. And we also took a very close look at the processes. So starting from the first moment when the patient calls or comes in to schedule an appointment, to by the time they register, they see the provider, they receive a bill, and then they make a follow-up appointment. We wanted to map this whole process out and identify opportunities for improvement. So we engaged a lot of the stakeholders within the practice operations department and brought them to the table to get their input on how we can do a better job and how we can improve all of these processes. And what this has helped us do is really expand our demographics, improve access to providers, and we're able to do a few innovative things like incorporate online scheduling. We became providers on ZocDoc, and we also use our own Cornell platform to make online scheduling available to new and follow-up patients. So what that did was really help us cut back on the manpower needed to be able to answer phones, schedule appointments on the phone, and also make it very easy for patients to come back and follow up with us. And we also incorporated things like time-based billing to make sure that we're actually getting credit for the amount of time we're spending with our patients, and gave us a lot of interesting ideas to diversify our revenue stream down the road. So the existing KPIs that Cornell uses to gauge the health of any practice are the ones to the left. And again, they're based very much on the amount we're billing to the insurance, amount we're collecting, the payer mix, how long does it take us to get that payment from the insurance companies. We're using those metrics, but we're also adding a few other things. So things like how many patients are scheduling the appointment, but how many are actually showing up? What is our cancellation rate? And this matters to us a lot more than a typical practice, because if we're spending an hour with each new patient and 30 minutes with a follow-up, each new patient that cancels can significantly impact our efficiency. So we wanted to pay very close attention to what our show rate was. And also looking at time of service collection. Some of the cash-based services, we really wanted to make sure that 100% of the time the payment was collected up front. We also started to track how many new patients we were bringing in. So we learned over time that close to 50% of our patients ended up being brand new to Cornell and New York Presbyterian. So that is a huge number. That is a huge gateway for new patients who are bringing into the healthcare system and referring internally. So we started tracking not just new patients, but also all the lab work, the imaging, the referrals we were generating by bringing in each new patient. For our more process-based metrics, we started looking at how many patients were coming in late, how long did it take for the patient to actually check in at the front desk, get their vitals, and be able to be seen by a provider, because we wanted to narrow that gap as much as possible. This matters a lot to us because we are doing time-based billing, so every minute counts. We started collecting patient satisfaction surveys. KeepSafe is a sort of a homegrown database that we use for quality improvement metrics as well, and work culture scores. So when we are talking about collecting performance metrics, it's always important to figure out how are we going to collect these things, right? Because the amount of time we can spend in collecting these numbers can be astronomical. So we have to collect what we can measure, and we have to measure what we end up collecting. So the first step was we came up with sort of a dream list of all the performance indicators we can possibly collect. But we had to whittle down that list to a reasonable amount that can be practical on a day-to-day basis. So we wanted to make sure we're collecting this data on a monthly or quarterly basis and actually doing something about these numbers and not just collecting reports. So we prioritized these KPIs based on how much effort it would take to collect this data and what impact it can potentially have on the practice. And then we partner with our EMR. We have Epic, and we sat down with our Epic team to see how many of these metrics can be collected automatically by a report that can be generated by Epic on a monthly or quarterly basis. And we brought in our stakeholders and engaged people other than Alka and I and designated tasks of who's going to be responsible for which report and what the frequency of that would be. what this does is really brings in shared accountability. Everyone is responsible for certain metrics, so anywhere from data collection to also looking at any trends that could be positive or negative and figuring out ways to rectify that. So what this does is really engages and empowers our entire team and helps each and every person be vested in the success of the program.
All right, so what's next? Because we're about 1 year from coming close to tripling in size and launching at a full scale. So we're getting ready now to go through many of the steps that we went through before, such as recruiting and marketing, but at a much bigger scale. So it's been very helpful to look back at what went well last time and what we can improve from the first time. So we've alluded to a couple of hurdles along the way. Looking back, the two most difficult hurdles were probably establishing the business structure and the fact that we had simultaneously so many interested and engaged parties rooting for this program. The most effective solution to both of those things was really ensuring that we had the right people around the table. So if we had to go back and do it again, I think we would probably make that a bigger push from the beginning, engaging the right people and having open, transparent conversation from day one as possible. Because the earlier everyone is able to declare their priorities, the earlier we're going to get to smoother sailing. We also had several successes that we're excited about. One of the main ones was our internal outreach. So when we look back at where our patients were coming from a year ago, most of our patients were hearing about us through word of mouth or through a family friend or by finding us on their own online. But when we look now at how our patients are finding us, they're finding us through other providers. So other healthcare providers, both inside Cornell and NYP and outside, are now referring their patients. So we've now been able to establish some additional clinical champions of integrative health, which has been a major success. It's also led to much more coordinated and much less fractured care. A second success has really been engaging leadership throughout the process on all sides. In our situation, we've been able to set up committees and structure around high-level leadership that allows us to speak transparently. So we meet on a regular basis, keeping all parties informed, and keeping all those parties engaged also helps us when we run into roadblocks, because it really gives us avenues and places that we can leverage to overcome those roadblocks. And probably our most exciting success has been the assembly of our team. So in addition to the two of us, we have 4 other clinicians that have joined our team over the last 8 months. And we've been seeing how successful the team is, how excited and how engaged the team is. And they've been really successful in embedding this program into the larger clinical care that Cornell and NYP deliver. So it's based on our journey over the last 2 years and our upcoming journey until we move into our new space. We could impart a few words of wisdom. These are some of our top tips that we would share. So the number one thing we would advise is defining success as early in the process as possible to help promote alignment. Second thing we've learned is that marketing in such an easily misunderstood field is really all about education and explaining exactly what integrative health is and what it can potentially deliver. When launching a new program, it's important to launch a great product, but it's more important to achieve excellence than it is to be perfect the first time around. So if you've got a good starting point, don't be afraid to jump right in at a small scale and then aim to perfect or aim to improve as you go along and constantly reevaluate. So continue to challenge any initial assumptions that you had at the beginning along the way, because that will ensure that you improve the product and the service you're trying to offer at a faster pace. So that's all we have for today. We want to thank everyone for tuning in, and we want to thank everyone in the Duke Leadership Program for all of their support and everything that we've learned along the way. We were in cohort 2, so we've gotten to to meet those that were in cohort 1 and in cohort 3, and I can say that when you look at the community of people that the program has brought together, I think we've got a really exciting group of people that are in a really interesting and very fast-paced field. So we're happy to help in any way that we can. So Tamara, I'm going to hand it back over to you, and we're happy to answer questions.
Great, thank you. Thank you so much. We do have a few questions in the queue. As a reminder, to ask a question, submit your text question through the Q&A section of your attendee control panel on your screen. Our first question is, what are the main elements of integrative medicine that have been most popular with your patients?
A lot of this has to be perfectly honest, a lot of this has to do with access. So the most popular is obviously physician consultation because it is covered by pretty much every insurance. So that has been the most popular. The other two most popular have been nutrition and acupuncture, again, because we do accept insurance. In general, the trend overall, if you look at all of the programs, this is pretty consistent, that nutrition, acupuncture, and physician consultations tend to be the most popular and well-reimbursed services.
Great. And similar to that, how are you able to bill insurance for acupuncture? One participant wants to know.
So billing for acupuncture is no different than billing for, a doctor's visit. You just use the right acupuncture CPT codes, and that's one of the benefits for us for being part of a healthcare system is billing insurances and getting reimbursement is sort of an established process. So all we had to do was add the CPT codes that are specific to acupuncture. And it's always important to educate patients that they call their insurance company and verify coverage because one person's Aetna is different from the other person's Aetna. So it's important to lay down that expectation for the patient. So our office actually spends a lot of time verifying coverage for each individual. It is a time-intensive process, but I think it's worthy of investment because when we do some of the heavy lifting on behalf of the patient, it opens the door for a lot more visits.
Absolutely. A few are interested in hearing a little bit about the qualifications your staff came in with. What kind of backgrounds did they have, and what were you looking for in your team?
It's a great question. It's really been integral to our success. So our team is a very well experienced team. Our acupuncturist actually did a fellowship at Beth Israel under the guidance of Ben Kliegler, who many of you may know. And he has also had long experience, over a decade of experience, treating inpatients and outpatients and people who have been, medically ill. So that was one important criteria for us, bringing in providers who are used to seeing people who are with several comorbidities and a little bit sicker than maybe the average New York City population. The person who provides our mind-body services has over 20 years of nursing experience, and she also helped to launch an integrative health program down at a radiation oncology center within NYP. So she had already demonstrated some of that entrepreneurship and self-motivation that we're looking for in our starting core team members. Our dietitian very much has embodied this philosophy for a long time, was doing exciting initiatives like cooking demonstrations and lectures and offering seminars in the community that we thought would be very valuable to our program. And we also have a massage therapist who has additional certification in Ericksonian hypnosis and is also a certified Pilates instructor. And she had been with integrative health programs at 2 other academic healthcare institutions as well. So the common threads here are that philosophy was aligned. All were excited to join a new team and kind of get in at the ground level. And third, that they had all had some healthcare experience before.
And one additional thing I would add is 2 of our providers were already at NYP. So don't forget to look for talent within your own institution, because I think that helped us gain a lot of acceptance early on, because a lot of providers already knew these 2 people. So it helped build that bridge and open referral source a lot early on than we would otherwise have.
Sounds like a strong team. The next question is, do you assess the impact of your efforts on patients' behaviors at all?
I mean, it's a great question. Very current topic. It is something we're looking to incorporate. We're not systematically measuring behavior change or measuring habit change, but there are several validated instruments out there that many integrative programs are using. So I agree. Everything that we're doing in integrative healthcare is about lifestyle change, and old habits die hard. So I think that's really the future of the field and a direction that we're looking to go in the near future.
Okay, and what advice do you have for other practitioners who are looking to convince their leadership to expand an integrative health presence within their organization?
I think one of the most important things is looking at the national landscape, right? So when you talk about institutions such as, Duke or Cleveland Clinic, Mayo Clinic, UCSF, Presbyterian, even Harvard programs. So pretty much every top academic center is investing significant resources in integrative health. So there's plenty of evidence, there's plenty of data supporting use of the modalities that we are incorporating into our patient care. So NIH is increasing their funding significantly to fund NCCIH, which is part of NIH, that studies and researches these modalities. So there is clearly evidence of far robust and growing evidence body than there was before, and there was a lot of academic institutions already doing this. So those are the two biggest sort of supporting statements I would provide to my leadership to gain that acceptance.
And there are also just think about who you're speaking to. So we've found that different arguments or different elements appeal to different people. So if you're looking more on the academic side, I know here at Cornell there's a great interest in trainee wellness, so medical student wellness, resident wellness, and this program can definitely help to fill some of those needs. It also helps individual providers. So many of the oncologists that we've spoken to, many of the pain management docs that we've spoken to, are being asked these questions every day by their patients, but they don't have a place to refer those patients, and they don't know if they're going to a reputable place, and then the information doesn't come back to them. So offering an outlet where you can directly address those needs and close the loop as far as communicating about what care is being delivered is very valuable to your referring providers as well.
Okay, and is there an average out-of-pocket cost for your patients that you can share? And how many visits do you generally see patients for? Is it a recurring relationship or more of a disorder-oriented approach?
Our goal is to work longitudinally with patients. So most of our patients have several follow-ups. So we have followed patients for as long as the year and a half that we've been seeing patients, but we'll also, the patient who is also just looking for a consultation or a second or third opinion also walks in the door. So it's a range, but I think in order to achieve true lifestyle change, it needs to be a longitudinal, ongoing relationship alongside their primary care doc. As far as fees, it's important to look at where you're situated and where what the people around you are offering as far as fees, and to be in range with that. So we've developed like a phone tree so that when patients are calling to better understand fees, the fees are transparent in case they don't have insurance coverage for nutrition or acupuncture. I think as transparent as you can get with the fees, the better.
And most of our patients, if we talk about out-of-pocket expense, is really related to their copays. So most of our patients see physicians, acupuncturists, or nutritionists have some sort of insurance coverage. And if it's not, the services that are not covered, I think like massage and mind-body therapies, those are less utilized services because of the obvious reasons. But what we're doing is launching group program initiatives sometime this fall to make those services more accessible and affordable to our patients. So all in all, right now, if someone came in, saw Alka and I for physician consultation and followed up 3 to 4 times in a year, and saw nutrition nutritionist and the acupuncturist, the only cost would be for them to see these people would be their copay.
Okay. And if you had to do it all over again, would you focus on one cohort of patients like pain or continue in your same model?
No, I think we've been able to provide a lot of value by offering a breadth of experience. So I think it's difficult to focus on one modality, especially if you're trying to build a new program like we are. However, I will say that if we didn't have as much leadership support from day one as we did, that would be the smartest way to start. So to embed yourself within an already supportive population, or embed yourself within a department where healthcare providers see eye to eye with this type of care, which generally ends up being oncology and pain management, because that's where a lot of the evidence base lies.
And because the scale of our program, what happens is if we were to limit ourselves to one diagnosis or symptom, we fall into the same trap where we're not able to really look at the person in a whole perspective. So pain can come from many different things, right? So it's hard, and people feel isolated sometimes. People would love to come and see us, but if we limited our services just based on diagnosis or symptom, I think we would not be serving the population that we set out to. Like Alka mentioned, everyone's vision, everyone's starting point is different. But we were fortunate enough to have the support from all different directions to be able to see patients from all different types of backgrounds.
Great. Our next question is for Damien, actually. It references the new Joint Commission guidelines that were recently announced. Wondering how the leadership program is preparing participants for these regulations, and if there's any changes being made to the curriculum.
Yes. Actually, we certainly understand the importance of this announcement, and we know what to do and how to address it. One of our core faculty members, Ben Kliegler, is going to address this at our on-campus sessions. We're looking into developing a toolkit for our program participants that they can bring back to their organizations to help address this. Our program is uniquely designed and positioned to address such issues. So yes, we are preparing for this in our curriculum.
Great. Okay, Alka and Chiti, were there any institutions with integrative health services that you were able to model?
I think we created sort of a hybrid model. So we did visit or sort of connect with several programs across the country. And we took a little bit of whatever we thought would fit us and came home with it. So I think it's important to learn from what is out there, but it's also equally important to understand your own institution and your own patient population and tweak it accordingly. And one good thing about this integrative community is every program is very open to share their experience so that we can all learn from it and we can all succeed together. So we were really fortunate to be able to get an inside information of all these programs, be able to incorporate their successes and learn from their failures as well.
Great. And you talked a little bit about the obstacles you faced during your establishment of the program, but what challenges do you anticipate going forward?
I think just given our imminent next step in about just under a year now, our biggest immediate challenge is going to be how to scale up, so how to amplify the care we deliver, amplify volume without amplifying waste. So we have a lot of variables that are changing as we move locations. And I think streamlining registration, streamlining collecting patient questionnaires and patient-reported outcomes, and being able to demonstrate efficacy of the intervention as well, those are going to be our biggest challenges going forward. And we're not going to figure it out on day one, but those are our priorities for the next 2 years.
And the challenges we will face in the future are not really unique to us. I think that's something the whole integrative community faces together. So when we talk about improving access and affordability of all these services, that is something we all have to think about it together. So I'm hoping that more and more of these services will be covered as national guidelines change to reflect the validity and utility of integrative modalities. For instance, with acupuncture and acupuncture and the pain management guidelines that came out. So I think that might work to our advantage. But at the same time, the overall challenge of balancing overhead costs, especially in places like New York City, and the reimbursement rates that you get for these services, it's a very delicate balance. So it's very important to keep an eye on the overhead, and that's what we're relying on technology to leverage technology in a way to reduce our overhead. So shifting towards more telemedicine-based visits for things like physician follow-ups, nutrition follow-ups, or health coaching allows us to cater to a lot more patients while reducing overhead and while expanding our program. So I think telemedicine is going to be another initiative. It will be challenging to implement at first, but I think in the long run, it will certainly pay off. And group programs. So as we understand that not all insurances, especially things like Medicare, are not going to cover acupuncture or even meditation anytime soon, it's important for us to pilot the group programs and create that platform where the services can be continually offered. And like Alka mentioned, start collecting the data on how are we affecting the quality of the care and patient-reported outcomes.
Great. And can you give us a little bit more detail on what this physician services entail? So, for example, what does a physician consult entail versus a lifestyle medicine consult versus primary care visit?
In an ideal situation, we are able to focus more on the integrative health and lifestyle piece and work in conjunction with that person's primary care doc. What we're finding is that a lot of our patients, as Chiti mentioned earlier, about 50% of our patients, 40% of our new patient visits are new to the institution. So they may not have been plugged into the healthcare system for the last sometimes several years. So in those cases, the initial visit ends up being much like a traditional physician H&P, with subsequent visits focusing on lifestyle and plugging people into the right resources to modify habits or modify their lifestyle. People who already come in with established primary care, we're able to discuss more about those underlying factors that modify disease, such as the diet, physical activity, exercise, community, support, mind-body connection, those sorts of things on the first visit. So it really depends on what that person's history is and how ready they are to discuss those things.
Okay. And in terms of continuing education, how do you value or view the schools and training programs that are reputable and worth the investment for you both or for your staff?
There are a lot of avenues for continuing medical education. So the training programs that are through University of Arizona offers a lot of online learning that offers CME, and even AIHM, who offers another fellowship avenue, has a great online curriculum. Institute of Functional Medicine also has CME courses. NCCIH, which I mentioned earlier as part of NIH, has a great online database of CME accredited lectures. So we also have to be mindful of the amount of time and money you're spending to get the CMEs, but there's a lot of reasonable opportunities that are online. Especially NCCIH would be my #1 go-to for free online resources. And even things like Medscape or more traditional, medicine-based platforms are incorporating a lot of integrative topics. So even updates on GI might include a lot of talks about gut microbiome. So this is integrative medicine starting to permeate mainstream a lot more effectively, at least on the education level. So I think there are many opportunities to get recognized and reliable information.
Yeah, I would agree. I think I think if you're pursuing the fellowship, one of the 2-year fellowships, those are great opportunities to build on whatever fund of knowledge you already have. But I would say if you're going a different route, then it would probably be a good idea to focus your interests at the beginning. In other words, don't try to be everything to everyone. Don't necessarily try to recreate this program at the beginning if the experience isn't there. So I would say, starting with one clinical area or partnering with a healthcare provider who may have more education experience. Those are all important ways to make sure you're ready to offer that to your patients. I would encourage you to not bite off way more than you can chew if you're brand new to the space.
Great. Well, there are a few other questions in our queue, but we will ask and pass those along to our presenters today since they seem to be a little bit more specific about the program parameters that you've set up. But I wanted to thank you both for participating in today's presentation and for such a well-rounded presentation, and thank all of our attendees for today. If you are interested in applying for our 4th cohort, I would encourage you to find the application on www.integrativehealthleaders.org and submit your application by September 30th. This recording will be posted to the Leadership Program website by this coming Monday afternoon. We will send out a notice to our listserv when it's posted, but I would encourage you also to check our website if you are interested in viewing it as early as possible. Again, thank you all for attending today's webinar, and hope to be in touch.
Thank you so much.